initially walk into the room, introduce myself to the mom. I'm already assessing the situation. I'm assessing the baby's sleeping area. If there's anything in the crib, I would take it out. And then also I would make sure that they have suction nearby. And that could be at the foot of the bed. I would also, but before all that, I would just wash my hands. If I'm about to touch the baby, I would make sure that I'm gloved. And then the first thing I'm going to do is verify that this is the correct baby. So I'm going to unswaddle her and check her wristband. It's right here. And then I'm going to reference it to mom's wristband. And then also I'm going to start just assessing her level of consciousness. This baby is quite alert, I would say. And then the first thing that we're going to do is just start auscultating before the baby gets too loud or anything. So first I'm assessing the heart rate. And actually you could use the bell since the baby's so small. If you have like a pediatric stethoscope, you can use that. So first you're assessing heart rate or pulse. And then for lungs, and you would do that for a full minute. For lungs, then you can go on the sides of the baby. And this gives you a better sense of lung sounds versus heart sounds because her heart would be pretty loud. And then I would go down to bowel sounds. And babies should have bowel sounds like within the first 30 minutes, even if it's just a little bit. And also if the baby's getting fussy and I can't hear, then I would stick my finger in the mouth and then you're assessing the suck reflex. From there, then we can start with the head to toe assessment. So I would take off the little beanie, and this is where I'm assessing the suture lines, the fontanelle, the shape of the head, the color of the baby, and all these factors are gonna add up to my APGAR score at the end. But I'm also checking the ears to make sure they line up with the eyes. You can like pick up the baby and do the full turnaround to support the neck. For eyes, I would then do a quick light assessment, although the baby will not like this very much. Then once you go down to the nose, you can occlude each nostril and just make sure that the baby can still breathe. Then we're gonna go to the mouth. I would actually stick my finger in again, and this is to feel the palate on the top, and also if there's like the sucking reflex again. The other reflex on the face, I would just brush the baby's cheek, and she should go towards it. So now I'm going down, I'm gonna be checking the neck, the chest, we're looking for coloring, the arms, we're gonna go down to her fingers, check there's all 10 fingers there, and then we're gonna go into this reflex where if we put our finger here, she should close. I'm gonna go down to her legs before we take her diaper off. So we're going through all the legs, looking at her toes, coloring, if there's 10 toes. You can look at the backs of the legs, make sure everything looks good. If there's any birthmarks, we're gonna document. Here we could also do the reflex where we just brush our finger down the foot and the baby should close its toes around your finger. Next we are going to open the diaper. And from here we're going to be looking at the baby's umbilical cord or how it's healing. Also we want to take the femoral pulse. And then at this point we could then assess the genitals. So this is a baby girl. You want to open up and just make sure that everything looks good inside. At this point, I will flip my baby, and we're now going to assess the entire back of the baby. So we can start back up top of the head, back of the neck, Just make sure everything looks good. We're gonna go down to the chest. We're looking at its butt. We would open, make sure everything looks good in there. If they have any birthmarks, we're gonna document all of that. And then I would flip my baby girl back over, and then I would do this reflex test where you slowly lower the baby, and they'll have like a flinch reflex. So we'll put the diaper back on the baby. And you can fold it so that the umbilical cord is not affected. If it's still healing, it needs like some air. And let me just make sure. So from the looks of my baby, I would probably give her, like, let's say she had like some discoloration in the fingers, I would give her an APGAR score of 9. She looks pretty good, she's active, all her reflexes are intact. Let's say her heart rate was normal, so she gets 2 points for that. Her respiratory rate was normal, so she'll get all her points for that. I'm also looking at her activity, or her muscle tone if she's moving around. So I can give her like a 2 or a 1 for that. Color, and then also grimace on her face. So the last thing that I'm gonna do is I'm actually gonna take her temperature. So let's just say I had a thermometer. We would actually go for underneath the armpit, and we'll stick it right in there and then push the baby's arm down. Take her temperature, document that, and then now we're gonna swaddle the baby back up. So when you swaddle, you can just hold the corner down like this, and you're wrapping the baby. You can go underneath this arm if you want. Some people swaddle with the hands like this. So you flip her or just roll her. Bring this part up. And you just want to make her nice and snug. Put her beanie back on. And there you go. You can give her back to mom.